Hi, and welcome to another video from the CTAG Clinic. My name is Dr. Mike Lloyd, I'm the director of the clinic, and today I'm going to be talking about the model of structural dissociation. So structural dissociation is an organisation of rigid and closed subsystems of the personality, and that rigidity often leads to a lack of cohesion and coordination in the person. So when we talk about structural dissociation theory, we think about the structure is designed in such a way as to maintain a lack of cohesion or coordination. The key theorists in the field are Ellert, Nijenhuis, Onno, Hart and Steele, and they wrote an excellent book called The Haunted Self, which is this. So The Haunted Self, which is probably one of the best books that you can get hold of if you're interested in reading about dissociation. It does look like a big book and can be a bit scary and intimidating, but it's very, very readable, and I would encourage anyone to go off and buy a copy and have a look. Right then, structural dissociation. So we consider that to be a cluster of states. So the way that our thoughts, our emotions and our behaviours are working together or working against each other gives us a sense of the structure of our personality and how dissociation operates. The key states are our emotional systems, our functional systems and our defensive systems. So the functional systems are the everyday life things. The defensive systems are widely considered to be the fight, flight and freeze systems. Many of you are probably used to the fight-flight in terms of how people deal with anxious or threatening situations, but we do have freeze added into that, so it's fight, flight and freeze. Emotional systems are obviously the nature of the emotions that we have available to us at any time. We would consider, in structural dissociation theory, to see these as being action systems. So these are systems designed to lead the individual to act. Often in the face of danger or threat, we require an action in order for us to move. But actually in everyday life, action systems are what we do. So all our behaviours can be reduced to action systems. And then the structural dissociation looks at how those action systems either complement or conflict against each other. In the basic form, we would go down the route of saying there are functional and defensive systems. So which are those designed to keep us going in everyday life and which are those are designed to defend us from threat? We can expand this, and I'll probably talk about this in a second video about structural dissociation, that there are primary, secondary and tertiary forms of structural dissociation, whether we're looking at, say, PTSD as a primary, borderline emotionally unstable personality disorder, or dissociative disorders otherwise specified as secondary, and then DID, dissociative identity disorder, as the tertiary form. But there's a little bit more we can look at on that basis. In terms of the terminology, go back to 1940 and a chap called Charles Myers, who was a military psychologist, looking at combat trauma in post-World War I, trying to understand the nature of what was going on. And Myers coined the terms apparent normal personality, or ANP, and emotional personality as EP. The EPs basically hold the trauma of the individual, and the ANPs try and avoid the trauma of the individual, and they do this through detachment, through numbing, through amnesia, i.e. the dissociative processes that we're aware of. So having a ANP and an EP soldier meant that the soldier could continue to function in everyday life, but every now and then, or under specific circumstances, an EP would arise, and that would lead that soldier to experience an intense emotional reaction, usually a re-experiencing or a memory of the trauma. We know now that that is PTSD, and it's thanks to the work of psychologists and psychiatrists in post-Vietnam that we have that greater understanding. An ANP is an enduring type of system that involves a wide range of context and is about functioning in everyday life. An emotional personality, the EP, is a short-term activated system that is designed to operate within a narrow context and is much more related to specific types of trauma. That's basically what structural dissociation is. It's the breakdown of the ANP and the EP, and the separation and split, the fragmentation of those two systems. If you ask why such a fragmentation could occur, we know that if you take any object and you apply stress to it, a solid object is likely to fracture and split off into different components. So either fault lines occur, in which case there is a gap between one and another, or is there an actual breakage of objects. and then we can see that the ANP and the EPs have become the separation of these objects under stress. And the greater the degree of stress, the greater the degree of fragmentation. So the nature of EPs, which would be considered to be the DID alters, the nature of those EPs depends then on the timing at which stress or trauma occurred, the frequency of it, and the intensity of it. So these are very, very unique systems. So no two people are going to have exactly the same types of EPs or alters, and understanding the nature of the alters helps us understand the nature of the traumatic experience which caused the split in the first place. An alter of a specific age tells us that it's likely that there was a fragmentation at that age of the person, and that's where the alter developed and sort of like shifted away, almost like a branch going from the trunk of a tree, that at a specific time in that tree's growth a branch developed, so that's an EP developed along those lines. That gives us that sense of the structure. For looking at the more attachment systems within structural dissociation, the work of Janina Fisher is particularly relevant. So she's an excellent writer and, well, therapist and writer who has really understood the nature of structural dissociation from an attachment perspective. So again, I would advise you to read up on Janina's work. If you ever get a chance to hear her talk, she's wonderful, so that will be really great for you. Janina Fisher spoke of dissociation being an irresolvable conflict of the self. So in attachment systems, that conflict is the desire to approach an attachment object, such as a caregiver, so the need for that attachment, in conflict with the fear or the threat that that attachment person might actually provide. An abusive parent, for example, is the best example of this, that a child has an absolute desire to connect and to attach to that parent, but at the same time might be threatened or feel fear from them. So that conflict is the stress that leads to the schism in the personality. And the EPs are designed to that manage those unpredictable and threatening environments. So EPs have a spectrum of behaviours. So some are involved in play-seeking behaviour, some might be about social engagement, some might be hypervigilant and very wary, and some might be violent and aggressive in that fight construct of the fight-flight. So some EPs might fight, some EPs might flight, and some EPs might freeze. And the amnesia occurs when that person might not be aware of the formation of those EPs, and so the trauma gets locked into an amnesic system where the EPs are aware of what's going on and the ANP is largely not, and that actually protects the ANP. So Janina's article continues by looking at the signs and symptoms of structural dissociation. So there's a list of these which I'll present up on the screen, but also they're obviously all within Janina's article. First is if you see manifestations of internal splitting. So you might see somebody who is functioning extremely well at work and yet cannot function properly within the therapy room. So there may be evidence of a lot of behaviours in therapy that aren't going to be seen elsewhere in the world for that individual. Another sign is that a person might have a very lengthy and difficult treatment history. They may have been in and out of lots of different treatment programs, lots of groups, lots of different forms of therapy. They may have been prescribed lots and lots of different types of medication and without an obvious success. A person may also experience lots of somatic or physical symptoms. There could be pain, there could be paralysis, and again where there's no response to medication, and that might be simply because the medication is not effective whatsoever to that person's somatic system. We can see evidence of regressive behaviours, so Janina talks about the type of posture, the way that a person speaks, the way the person behaves can be very childlike in quality, and there may be lots of emotional issues present, so it could be very emotional clinginess, a fear of abandonment, inability to make eye contact, a sense of fear and mistrust of therapy or of doctors or of medical personnel, people that might not believe them, for example. Might be patterns of indecision or conflict within the person's life, so that could reflect an internal struggle that an individual is going through. For example, that they may find it very difficult to commit to anything, maybe multiple different changes in life and in direction, and the person has conflict between success and failure. They're not able to maintain a consistency of a behaviour. Person can often have memory difficulties, so that'd be a very common thing to see within structural dissociation, so a loss of continuity of time. So a person has gaps, either historical or everyday gaps. They might have problems with losing time and forgetting skills, and a person lastly may also exhibit patterns of self-destructive and addictive behaviour representing internal conflicts. For example, if an AMP is continually being activated into EP states by triggers or by everyday ongoing conflict, it may be necessary for them, or feel necessary for them, to then use substances or alcohol or self-harm in order to manage that emotionality that they're not able to in their own way. So that's really an overview of structural dissociation. Obviously very basic, and there are lots and lots of additional factors which I can make videos or as we go. The key components to this is that structural dissociation is a fragmentation of action systems. So a person without this is able to act in a cohesive way that makes sense over a period of time. And someone with structural dissociation has lots of variability and a lack of cohesion, lack of coordination of these action systems. The action systems largely being functional, everyday life stuff, and defensive protection of the individual, fight, flight, and freeze. All the references are coming up, so the main articles that I've spoken about, and also please feel free to leave any comments at the end of the video and any other topics to suggest for forthcoming videos from the CTAD clinic. So that's it for the time being. Thank you very much for listening, as always, and I'll hopefully see you again. Take care.